There's increasing speculation that the first COVID-19 vaccinations will be publicly available this month. Pfizer and BioNTech have applied for approval in the European Union. Moderna has already said it will seek emergency approval in the US and EU. And Moderna CEO Stephane Bancel joins us now. So, Stephane, Moderna's vaccine candidate seeking emergency approval in the US, and there are plans to seek approval in Europe as well. What about here in Asia? Which are the countries that have signed up for your vaccine, and when can we see it publicly rolled out?
Yes, good evening, and thank you for having me. So we have a few countries in Asia that have signed up. Singapore has been one of the leaders in Asia. It was actually the first country in Asia that signed up for a vaccine back last summer. More recently, Japan as well, and a few other countries that have not disclosed yet. What we announced yesterday is the phase 3 study. The latest study is finished. We have the data. It was 30,000 people tested, 15,000 on placebo, 15,000 with our vaccine, and we've shown a 94.1 efficacy rate. What does that mean? That means that 94.1% of people that got the vaccine got no disease. And the few percent who got disease, what we know is there was no case, 0 case on the vaccine of severe disease. What we saw in the study is a total of 30 cases of severe disease. The 30 cases were all on the placebo group. So it means if you put those two data together, that the Moderna vaccine, if you get it, you have 94% chance of having no disease, and you have 6% chance of having a mild disease. There was 100% efficacy against severe COVID disease, which is so important because, as you know, what has been really a big impact on public health and the economy is hospitalization.
Absolutely, and it is those results that have resulted in Moderna cutting multiple deals across the world for your vaccines. I'm wondering, how do you meet the needs of the more rich countries or governments that are wanting your vaccine versus the ethical questions of providing the vaccine to those who need it but may not necessarily be able to afford it?
Yes, so we are in very active discussion with COVAX. As I'm sure you're aware, COVAX is the line that has been set up by the WHO with Gavi and CEPI. So we are in very constant dialogue with them. We made them a proposal back in August for tiered pricing, where basically low-income country will get a much cheaper price than high-income country, which is done regularly for vaccinations around the world. And so we're having active dialogue. Given the good efficacy of our vaccine, it's very important to us that the vaccine is available around the world, especially for people at highest risk. I think a vaccine with lower efficacy from other companies can be given to younger people. But we think for older people, healthcare workers, people with high comorbidity like diabetes, they should get the vaccine with the highest efficacy, regardless, as you say, if they're in a rich country or they're in a poor country.
Also, speaking of cost, I believe, according to reports, Moderna is pretty costly, ranges between $25 and $37 per dose compared to the other front runners. What are the chances of that cost coming down, and also production meeting the demand once the vaccine is being approved?
Yes, so indeed, the cost is a bit more expensive because if you think about it, the technology is new. Moderna has never made 1 penny of profit. We have invested more than $2 billion over the years. This is now a 10-year journey to get the science to this place. And so the cost of making it is still expensive. We don't have a scale, if you think about it, of a Johnson & Johnson or an AstraZeneca that have very big manufacturing scale. We have been investing all year long. We actually even raised money in the capital market by selling stock to the public market in May. We sold $1.3 billion to get cash, to buy machines, to buy raw materials. Our current plan is to have between 500 million and $1 billion in 2021. And so we're working very actively to increase that as much as we can. As I've said all along, the world needs several manufacturing companies to make it to the finish line to approval. No company in the world, even Johnson & Johnson or Pfizer, which are a gigantic company, around 100 times the size of number of employees that Moderna has, not one company can supply the planet. And so we need many companies to make it, which is why we were very happy when we saw the positive data of other vaccine companies.
Well, we really want to thank you for joining us. We've been speaking there with the CEO of Moderna, Stephane Bancel, speaking to us live there.